So into our first part of the treatment, we're going to work the foot from starting the plantar aspect and work from the superior part down to the inferior part. Then we'll progress to working the lateral medial, the arch, the spine, the lateral aspect, the joints, and then the dorsal aspect, which will be lymphatics and back area. But today we're just going to focus on the toes. Okay, so we always have to have one hand working and one hand supporting. We use the fingers of the working hand as leverage. If I work the toes like this, they go all over the place. If I use leverage, we keep them firm and we can get more pressure. I always want my supporting hand to be close enough to where I'm working. If it's way down here, it's not really giving much support. We want it to be up here. So the whole foot is worked in a reflexology treatment, but a considerable amount of time is spent working the reflexes that come up as tender, which we mark as a triangle on our sheet, or as with crystals, which we mark as a star on the sheet. You can use relaxation techniques at any time throughout the treatment. You can break it up and add in a spine stretch or a ringing or toe rotations anytime, and I'd encourage you to do that because it can get a bit monotonous for you and the client. So do add in some nice relaxation techniques at any time. The first thing we do is we thumb walk our pressure point on and around the big toe. So here we're working the pituitary gland, which is dead center of the foot, and we're also working the pineal gland, which is in the same place, but in the body it's further back in the head. We're working C1 to C7, which is the cervical vertebrae, which is from the shoulder line up to the top of the toe. We're working the brain and the sinuses, which is the tips of the toes. We're also working the muscles of the neck, which would be the lateral aspect of the neck. So the muscles are the side of the neck will be here, right up the side of the big toe. And then we're also working the atlas and axis, which is this top point here, where we have C1 meeting the skull. And then we're working the throat and the thyroid area, which is here. I also like to work the thyroid dorsally, which is on the back. And that is all, I think. Yeah. So just be aware what you're working when you're working an area. So I like to support with the left hand, and then with the right hand, still using leverage, we're thumb walking up. Just from the throat area, the shoulder line, right the way up to the top of the toe. There are some techniques for working the pituitary, which I'll show you at another stage. If you come across any reflex that's tender, you can refer to the specialized techniques, which I'm going to show you later on, which we will use. Yeah, so I found tenderness there. So we will use specialized techniques for the ITEC exam, and I'm going to show you them once we get the whole foot done. But for now, when you come across an area that's tender, just press in and hold. You can add in some circles, but I like to just actually press in and hold. I find that has the most effect. For the client, usually the pain's going to last about 10 seconds. There's no need, once the pain goes away, to keep adding more pressure or anything. Once you've stimulated and found the tenderness, that's fine. So has that eased off there? And we can hold for up to a minute. I will continue on. So this is known as our touch testing pressure pointing. We're going to go right into the side of the neck here, making sure you're stabilizing the toe, making sure you're not twisting your spine, your own spine, right up to the top of the toe. And then we're going to bend the toe like this, use our index and middle finger with our thumb for leverage, and thumb walk across the dorsal aspect of the big toe. And I am going to show you another way to treat the thyroid here at a later stage. Okay. To work the toes, we're just going to squeeze, again holding support with your left hand close to the joint, the metatarsophalangeal joint, and then we're going to squeeze medial and lateral side of the toe together. Really important to really work the toes, spend a considerable amount of time livening the toes, wakening them up, getting them ready for the work that's coming, stimulating the zones. So we start at the bottom and just finger and thumb walk right the way up. We do the same then dorsal and plantar. Squeeze, squeeze, squeeze. So here we're working, the tips of the toes are the sinus, head area, brain area. The teeth aren't on your diagram, but I often find just under the distal phalange here, you find the teeth reflexes, just at that ball there. Sinuses you can also get just under the nail. Second and third toe, just above the shoulder line, we tend to have eye area. And if it's a more chronic eye problem, like a long-term thing, I find that it shows up just on the shoulder line there. And then zone 4 and 5, again, same area just above the shoulder line, this would be ear. Between those two, and again, this isn't on your reflexology chart, but between these two here, you tend to have the eustachian tube, which anyone with ear problems will really benefit from having that worked. Squeeze, 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 squeeze. So that is how we work the big toe and the toes. Okay?